in the Institute of Public Health, one of the premier public institution of Pakistan. Rather, I think it is one of the premier of the subcontinent. So, Madam, can you elaborate some of the salient features and its past history and a book you have compiled?
Thank you very much, Dr. Kolachi. This institute was built in 1898 by the generous support of the government and the Viceroy. Viceroy at that time was Sir Charles Revos, and he allotted more than 88 canal space for this institute. And the vaccines that were developed at that time, they were not only for the subcontinent, but they were also being dispersed to other countries and districts of Lahore, including Rawalpindi, Multan, and at that time, as you know, that there are many countries that are part of the subcontinent like India, Nepal, and Bhutan, Pakistan, Bangladesh, and the vaccine all have been built here, they were developed here, and then they were sent to the other
Can you name
areas.
the vaccine smallpox and some other vaccines, rabies, or what type of the vaccines?
Right. That institute was actually the Institute of Vaccination and Prevention, and the basic work was done not only for the vaccine but also on hygiene and to decrease the waterborne diseases. The vaccine that you have asked about is most of the vaccines were developed in seed at that time. So we have the cattle house still now at Institute of Public Health, and the horses that were kept in those houses. And the sera that have been obtained from the horses and cattle, they were marketed, and it was for tetanus as well as for other diseases including cholera. And as you have mentioned about smallpox, it was developed in chorioallantoic membrane. And Dr. K. Shah, who was also the first dean of Institute of Hygiene and Preventive Medicine, he was the one who was given this post of superintendent of Punjab Institute of Vaccination here. He was the one who was developing the smallpox vaccine in chorioallantoic membrane, and that vaccine was then dispensed throughout subcontinent. Later on, when the smallpox eradication efforts were done, this place acted as the center for the smallpox eradication activities. WHO and all the international organizations, they collaborate with the faculty and the human resource that are available at this place. And they started the smallpox not only for the areas in Pakistan, but the areas of Bangladesh, because at that time it was East Pakistan. This part that is now Pakistan, it was at that time West Pakistan. Moreover, the administrators, hospital managers, they were trained here, not only for this part of the world, but also for other countries as well as from Bangladesh.
Thank you, madam. We are short of the time, but as you are the dean and taking this responsibility, we have observed a new change or rather a sea change because I remained the student in 1997. So it was just like a forgotten institute, but I think you have given a new look as well as new programs, artificial intelligence. So do you think that the glory of this institution from Pakistan to subcontinent and other countries can be obtained once again?
Yes, you are very right. I am so proud of this fact that being a personal who is the professor of community medicine, and I know what is the importance of preventive medicine, how the health systems, they should focus for the glory of the country, for the development of the country, on systems, on system analysis, on data-driven policies, on artificial intelligence, on research-based policies. We are conducting policy dialogues, journal clubs. We are having 18 and more departments here, including preventive pediatrics, mother and child health department, epidemiology department, biostatistics, bacteriology, and many other departments. So the importance of the prevention, that is always towards the better health of the community. And the better health of the community leads to the better nation, stronger nation leads to the stronger
Last
country.
message, madam. The polio eradication is a challenge for Pakistan, and we had been facing this problem. As a dean of the Public Health Institute, do you see that Pakistan will soon be polio free and we will rise in the public health?
I am 100% sure that just like other countries who have eliminated polio, we would also be able to eliminate polio. But for this. We have to think seriously of developing our own vaccine.
Thank you very
Until
much.
unless we don't
Thank you.
develop our
Thank you.
vaccine,
Thank
it's
you.
very difficult.
Thank you. Yes, that's the point. That's the key point.